Video is on. Audio is on.
Share
Screen. The one thing I wasn't sure is if you share content, will it show this one or that one?
Let's see.
PowerPoint.
Pick.
Maybe
So,
the PowerPoint. Or
so I think we're gonna do this,
yeah,
Right.
probably.
and then load it.
Yeah.
Welcome to WebEx.
You're sharing that screen.
Enter your
Okay.
access code or meeting number.
Thank you so much. Awesome. Now that that's out of the way, I don't know if I have to be here or
Enter
not.
your
but-
attendee ID number, followed by pound.
All right. Good afternoon. Good morning, everyone. It's almost afternoon, but very nice to see you all. It's been already very refreshing, as she was saying, to meet people in person after a long time. And especially, it was a great start for the morning to hear from the speakers. So welcome, everybody, to this workshop. And this is your first workshop of the day, and I hope to deliver. And so today, the topic of the workshop is solutions to improve older adult engagement with community organizations. I'm Kavita Nyanasamandan, as she introduced. I'm really happy and excited to be here. Thank you to NYS and Aging NY for this opportunity to share what we have learned in the past 1.5 years and share that with you. And in terms of presenting them as solutions that you can consider moving forward as you deliver your solutions to older adults. So really the hope for today is to give you some toolkit with both technology and non-technology based solutions that you can use to just improve the way you engage your older adults with your services and programs. So I hope you can take away something from the workshop on that regard. So I'm going to start with a quick introduction on who Blooming Health is, so we can give you some context for the topic of the workshop itself and then go from there. So Blooming Health is a social health partner on demand. We really started Blooming Health to build purposeful technology solutions that can specifically help older adults and community organizations that are serving older adults. So we want to flip it on the head in terms of developing technologies that work for you rather than making people learn technology and train and get used to technologies that have been already developed. So we started, therefore, with a very humble approach of learning from you on where you are today and developed very custom communication solutions so you can, again, as aging in place providers, better engage older adults through one central platform. From what we've learned on the ground, there's a very fragmented communication system today through emails, text messages, phone calls, and many other more. So we want to see how we can help improve your efficiency, but also help improve other aspects of your services and programs itself for older adults so they can be more aware of them and also better use them. So the team really is 3 New Yorkers who have backgrounds in healthcare, data, technology. We didn't know anything about community-based services, but we've really learned a lot over the last 2 years from our partners in New York City, and we're starting to again partner with more organizations in upstate New York as well. So as indicated, the Dorat, Union Settlement, Griot Circle, Catholic Charities, Bronx Works, Self-Help, and Social Creatures have been really instrumental for us to learn what are the pain points today in meeting and engaging older adults with your services. Especially, we started doing this before pandemic, and therefore it really hit the nail on the head when we hit the pandemic and everybody was scrambling, how do I reach my older adults? Not everybody has a tablet or a smartphone, so I cannot reach them, and not everybody is going to learn Zoom when I pivot to virtual programming. How do I reach them? So all these problems, we were able to experience them on the ground alongside our partners. So that's how we developed a solution, and hopefully, again, that'll be reflected in what our partners are going to be sharing as well. They were not able to join today, but they've recorded videos and shared their learnings and key tools and techniques that they would suggest for other community partners. So I want to share them as part of this presentation. Also, I want to keep this very interactive. So there's going to be some polls throughout the presentation. We're going to use a tool called Poll Everywhere. So I'll show you the instructions for how you can participate on the screen. And hopefully, again, we can gather everybody's voices both here and those who are joining from WebEx as well can participate and we can see them together. So why are we here today? So as I mentioned, I want to set some context first on what's the need. It's very easy to convince the people in this room and those who are joining online on why we need this based on what we've gone through in the last 1.5 years. But also I want to share some tangible tools and techniques that you can use in your toolkit as you go about after you leave this conference. So in terms of starting today's conference, I thought it would be very helpful if we can start by reflecting on what went on in the last year. So I already posted this polling question in the app, but I also want to give the opportunity for people who haven't participated to share your input on this. Because we've all undergone very ups and downs over the last 1.5 years. So if you had to summarize that all in one word, how would you do that? You can answer this poll by going to pollev.com and you can enter the code KG095 and you should be able to see the question there. You can answer and we'll see them as a word cloud. So as you answer them, I think the word cloud is going to form on this. And forgive the slide itself. There's some technical issues with that. You can also answer via text. You can text KG095 to 22333, and that will also record your responses for this. I know we've all been through a lot. It's difficult to summarize in one word, but I think it really brings out the feelings that what everybody's gone through. Chaotic, lonely, strained, educational. Educational is very reflective. Different. Yeah, I agree. I think there were a lot of different emotions, almost similar to grief that everybody had to undergo. But it's phenomenal, despite all of this, what we've achieved in the last year. Challenging, lonely. A lot of people felt lonely and challenging. And that's why it's even more reassuring when we are coming together as a community today. Like, I know you guys didn't have the conference last year, which would have been very timely to help one another and share your experiences. So this is nice. All right, I'm going to give 1 more minute and then I want to share what others shared through the app as well. Yeah, challenging and lonely is definitely the theme that I saw in the other responses as well. For me personally, it was always ever changing. One thing after the other, we were continuously adapting to what's going on. Great. Thank you so much for everybody who entered your responses. So I'm going to show next. So these are the responses that we got from the app also. So you can see the similarities between what we just saw in this one as well. So everybody, again, it's a common theme to feel challenged, to feel chaotic, lonely, and exhausted. And you're not alone in that feeling, at least. And the way, again, we've all pulled through this, despite all these emotions that we felt, is really mind-blowing. And I think this definitely kudos to everybody out. You guys were front and center of this. So definitely kudos for what you were able to achieve despite all of these emotions. So I think for me, again, witnessing this power of community through these difficult times, despite feeling challenged, despite feeling chaotic and lonely, I think the amount of work you accomplished in getting the meals to people who are in need, to provide socialization, to distribute devices. Like once people figured out that there was a digital divide issue, they found out different channels through which they can acquire devices and distribute them to their older adults, and quickly again try to train them, try to help them come on board, get them internet and Wi-Fi, and also vaccination that came soon after that. So I just want to acknowledge all that has happened, and definitely this shows what is possible and what is achievable in the future as well. So let's start on the positive note. So anything that I say after this is mostly around how can we again build on this and do more. So in terms of this kind of community support, there's no reduction, right? It's only going to increase. It's only going to keep growing as we have 81 million older adults by 2040. And that's just 20 years away. And at least 6 million of them are going to be here in New York. And 90% of them want to age in place. So your services are not going anywhere. You just need more of them to support more people. And of these 90%, only 50% think they can age in place because they don't think they have all the necessary support that they need as they become older to live in place. So that needs to change. How can we help more people age in their own communities? And of course, 27% of them at least live alone. And especially the population that's served by community-based organizations are even more. It's at least 40% of the population based on the ACL data. So when somebody is living alone and wants to age in place, their needs are even greater. So as we go through aging, each one of us experiences aging in a very different way. But what you see here on the graph is the gradual decline that happens in both the health and the functional capacity, and therefore the level of caregiving and support that we need over time. So when you're in the normal aging curve, or the average, as anyone can call it, is you're mostly independent for a large majority of your life. At some point, you become frail and disabled. And the more you're living your life as frail and disabled, that's when the impact on your quality of life, your health and well-being, and your mental health as well is much higher. And therefore, the needs to support that population is greater on the society, on the systems as well. But we can impact it, right? So this is where community-based healthy initiatives come in play, that you can really shift the curve from being accelerated aging to normal aging as you train people early on at 60 plus or even 55 plus to incorporate more of these healthy aging lifestyles. And this can really make a difference, not only saving lives, but helping them live longer and happier. I think that's a really key goal that community-based organizations are achieving. So in terms of the different aging needs, you're very well aware there's a Maslow's hierarchy of needs. This has been modified to fit the healthy aging needs by the MIT's Age Tech Lab. So in terms of aging, there are at least 5 levels. It starts with health, the basic food, medications, exercise, and then safety. People need to be safe in their own environments, and this is where the elder justice programs come in play. And connectivity, all the programming that you do to keep people engaged in the community, socialize with one another, participate and contribute to the community is really important through volunteering and the learning aspects. And legacy, everybody wants to leave a legacy. They're really keen on how can I transfer what I know and what I've achieved in my lifetime to others. So these 5 levels of categories are all of them, in fact, are being impacted by what services you offer in the communities. Especially the communication aspects are critical to help the older adults access all these different aspects of these services and needs, because only if they're well connected to you, to your community organization, they become more aware of these different levels of services and opportunities to address their needs, and therefore they can better engage with you and utilize them and really have a more healthy aging lifestyle. So the goal again is to see how can we improve that communication aspect. And of course, apart from communication is also, as everybody here already knows, the role of transportation. the role of having places to congregate where they can meet one another and also learn about what is going on in their community, because one way in which communication happens fast is word of mouth. So we need to complement technology-based solutions with other opportunities to spread the word about what's happening in the community. So in terms of the pandemic, another key aspect that became to everybody's forefront and thinking is social isolation and loneliness. So even before the pandemic, when we were doing focus groups with older adults, this was one of the questions that we were asking them. Can you rank what are the top 3 happy moments you can think of and moments that you were unhappy? But first, let me show you what people said when they were happy. It's pretty tiny on the screen. I don't know if you can read them, but a lot of them were around meeting friends, seeing my grandchildren, getting with my friends at the NORC, having lunch with someone. These were the majority of what we heard, and it was 72% of the answers that we got was around social connection. And at the same time, when we asked them what makes you unhappy, a lot of them said, again, this was also around your social relationships and connections, but it was also around health, it was also around the community. So older adults feel a lot more unhappier when they see businesses going out of their neighborhood. The neighborhood is changing. I don't feel like it's the same neighborhood I grew up in or lived in. So there's a lot of things that make them unhappy, but really the root cause of happiness and what makes them feel more engaged in life in general is social connection. So it's really critical for us to, again, keep this in mind as we develop programs, services, and communication methods to engage older adults about, again, helping them socialize in each one's own way. And again, the data during the pandemic collected by AARP survey here shows that at least 60% of 50 plus older adults, whether they were men or women, felt isolated during the pandemic. And I will acknowledge this was common across the ages, right? It is not 50 plus alone, but what is important here is the impact on their health. We know that social isolation increases your mortality by 45%. The risk of mortality. So I think this is really critical to pay attention in this particular population and how we incorporate it in all our ways in which we communicate. So I want to stress again the importance of connecting older adults to the different needs and services that are occurring in their community through these different organizations, right? I may not have represented all the different types of community organizations here, but there are much more that are helping them achieve these basic social needs and basic daily needs that they need to live and age in place. However, there's not good ways in which we can connect them. It's not just about awareness, it's also about connecting them. And even if they know that something is going on, during the pandemic, some of the older adults we were interacting with were clueless. If I need a medication, I'm not going to stand in the pharmacy line at 1 a.m. in the night because that's when I could get the medication. I don't know who I can ask to pick them up for me. And also there were older adults who didn't know where to get tested. I know all of us were clueless about this at some point in the March to May, but they were again clueless in terms of we were trying to find out information and help them. But we can, in general, sense that the level of uncertainty that all of us were undergoing was at least 2 times or 3 times much more for older adults. And similarly, when we were talking to our community partners, they were again uncertain of how to reach their older adults. Like, I know many of you may have made thousands of phone calls, like in terms of just reaching older adults. And that's a very important way and mechanism to reach older adults. But unfortunately, the scale at which we can do them cannot reach everybody in time to get them the help they need. And therefore, they were feeling exhausted and frustrated that they were not able to reach everybody in an easy to access way to find out even if they're doing okay. And that was, again, a key challenge that we heard. So I just wanted to ask a question to the audience here in terms of how you experienced this challenge during the pandemic. The question really is, can you please rate the level of challenge you experienced in remotely communicating with your older adult clients during the pandemic? If you are texting, please text A, B, C, D, or E. Otherwise, you can go to the website there and you can answer with the numeric ratings as well. Extremely challenging, yeah. Yeah. So I think this is very helpful to see how this was not specific just to my one cuckoo in the New York City, but I wanted to validate how the experience was for you guys in New York State and across the state as well. So this is helpful to see, and unfortunately, this has been a challenge across the community-based organizations. And we are here again to brainstorm on solutions and think about how we can, again, hopefully there's no crisis in the future, but still this is an opportunity to reflect and improve upon in terms of how we address this challenge. So the key question we want to address next is how can we improve this connection and engagement between community organizations, which I refer to as CBOs here, and older adults. So I see the solution as having two key components, right? One is a flexible remote communication system. And then the other is how do we implement this in a lean and a data-driven manner? Because we know the environment that we are at in different organizations is resource constrained, or we don't have the level of funding that you need to be flexible enough in terms of applying it for certain things that you want to use it for. But there are ways to, again, implement new solutions in a way that's, again, efficient for you, but in a way that's also going to generate some data that you can use to get more funding. So let's talk about these individual components and therefore how you can generate more continuous engagement and to be there for the older adults when they need you. What do I mean by flexible remote communication system? So there are at least two key words here, being flexible and remote, right? So remote is important only because what the pandemic has shown is there's a lot more older adults who need your services beyond the ones who are able to come into your centers in person. And that was really, to me, again, the word is overused, but a silver lining is remembering those older adults who are more homebound, who are staying distant from your center and don't have transportation to come to your centers, or those who are, again, interested in your services but are living in other regions, even perhaps not in your county, but in other counties. So especially, I know when you are offering very culturally sensitive services to certain segments of the population, like LGBTQ, or a particular type of ethnicity-focused programming, then more people want to access your programming. So how do you reach more people remotely? That's one key. And then being flexible, because each one prefers to communicate in a certain way. And this is true for older adults as well. Some people are okay with text because it doesn't bother them too much. Some people only can access phone calls because they don't have a smartphone, they don't have a email, they don't have a desktop, and things like that. So based on each one's preferred communication modes, what they can access, how can you address, again, have communication systems that are addressing the digital divide and also different language preferences? We are living in a community that culturally becoming more and more diverse. So that's one aspect, having multiple communication channels. And then using these channels in a way that's more low touch but continuous engagement. What do I mean by low touch? Low touch is one that's where you're sending them, say, simple messages that helps them remember that there's somebody that's thinking about them, somebody that cares about them. But also it's more continuous and over a long term rather than happening in bits and spurts. When they come to you, for example, maybe when they want to sign up for food stamps, but after that, you don't know what happened to them. Did they get food stamps? And then maybe next time it's not about food stamps, it's about unemployment or something else that happened in their life. But when you have a more continuous relationship, it helps you anticipate what needs they have, but also it helps you plan how you deliver your services for them. So that's one aspect of it. How can we deliver more interesting program information that's useful to them at the right frequency, but also keep it two-way, not just delivering information about you, but also checking in on them. How are you doing? And things like that. And keeping this channel more fun. Like doing some interesting games once in a while, or quizzes and raffles. And then the third aspect is really complementing this with high touch. As Greg was saying earlier, technology is not the solution. It's just one of the things in your toolkit. You still need to complement this with high touch human engagement, but now because you're using technology or data to automate some of the routine tasks, you might have more capacity, hopefully, to talk to people and engage them in a quality manner. And this is one way where I'll say technology cannot replace human connection, but it can help strengthen it. Because the pandemic showed that too. Like the Zoom was not equivalent to us connecting here in person, but it helped us stay in touch with each other. So in terms of how we customize our communication modes, one thing that you may have to know is each of your populations are different. When you've seen one senior center, you've only seen one senior center. It doesn't represent every senior center in that area. So how do you know what's important to your members? You need to collect data. You need to collect information, what's important to them. So what this slide shows is, and again, an average in the US, 80% of older adults own cell phone of any kind. So you know that's a key channel through which you can reach a lot of them. And that was again known through the wellness calls that we were doing during the pandemic. And in some older adults, like as per the AARP survey, as you can see, text, talk, and email are the three main reasons why older adults use a cell phone. Some of them use it for social media, messaging apps, and other aspects as well. But texting, talking, and emailing are the primary purposes of why they use cell phone. And therefore, again, those can be your secondary and tertiary methods of communication. And then in terms of the focus group that we did with older adults, we were trying to, again, understand, okay, even for example, if you have access to text, talk, and email, what would you prefer? Many of them chose one that was not on the options. I would prefer to meet in person, right? That's what most of them want to do, meet in person. But if given these three options, they would choose, again, phone calls, most likely than email and text. And this is representative of 25 people in New York City across different boroughs, but still it's a small population, but I'm showing you an example of what you can do in terms of collecting data and knowing about people's preferences. And this will in turn help you develop the appropriate system internally. So you don't have to invest in 10 different systems. You invest in one or two tools that can help you deliver the message right. So in terms of what your knowledge is or what your experience is, how would you rank the top communication methods that you use to remotely connect with your older adult clients? If you go to the website again, pollev.com/kg095, you should be able to rank which one is your most preferred method and what you use today to communicate with your older adults. I think you may have to use the arrow button, and then it will move things up and down. Interesting. So far, phone calls are the largest preferred option. Then snail mail, because that's an interesting one, because you can definitely know they're going to get it, and there will be no access issues in terms of snail mail. So that's an important mode of communication. Text message is where I see people are mixed in terms of how you use text message, and I understand because it's not always scalable for you to text people individually unless you're using a mass system. Great. Thank you for answering that poll. So I think based on the results we see here, we see that phone calls is the majority of people prefer to use phone calls to communicate with older adults. And snail mail is the second best option. Emails is fast coming up as one of the preferred option. As more people are learning emails and technology, I think that's definitely one easy and scalable way to communicate with older adults. So now I want to present how we developed our communication solution, only again to provide context for some of the case studies that I'm going to show you later on how the solution was used during the pandemic. So the solution that we've developed is again based on a lot of focus groups and pilots that we did with older adults and CBOs. And as you can see that we've chosen text message, phone calls, and emails as the primary mode in which we deliver our solution. The goal of this solution is really, again, to help you centralize all the fragmented communication that's happening in your organization today in one place, but also use it in a way that's engaging for older adults. Like it shouldn't feel like I'm replacing a human with technology, but more you're complementing your human connection with this to stay in touch long term with older adults, but also in a scalable way. So what we offer is helping CBOs to improve your capacity because you now can automate some of your routine tasks. And at the same time, you are letting the older adults know more about your programs and engaging with your programs. And older adults in turn feel that they're more connected with you. They not only see you in person, they also hear from you via text or phone or email. And they also participate more in your programs. So their overall social engagement increases. So in terms of how people or how our community partners are using this service, there are multiple use cases. Basically, the capability we give you is you use this one-click platform to send your messages to seniors, both one-way information about your programs, and it can be reminders that are sent a day in advance about your programs, can be broadcasts, emergency announcements that your center is shut down for some reason. But you can also do two-way communication, make it interactive, ask them how they're doing, like simple check-ins or surveys about how you are doing. How is your programming? Is it how they're satisfied with your programming? And collect outcomes data that you can use to report to your funders and others. And we also, again, provide data and reporting on this. So you can use that data to, again, for internal analysis purposes, how do I improve what I'm doing, but also reporting externally. So I'll show you some specific cases on how this works and how it has helped our community partners. So in terms of program reminders, the key part is we provide multiple channels. This is customized to each of your older adults. When you sign up the older adults, they tell you, I want text, or I want email, or I want both text and voice, whichever it is that they prefer, and what language they prefer it in, English, Spanish, Chinese, anything. There's no restriction on the languages. And then when they receive the message from your end, you input only one message. You just say center is closed today in English, and it automatically goes to say John in text message, to Mary via phone call, and to Jose via voice calls and in Spanish. And so it's all automated through the technology platform in a way that's, again, scalable for you to do it and still personalized to the older adults. And in terms of the check-ins, here you'll see an example for how the check-ins work. So it usually goes in as simple questions that older adults can answer. How are you doing today? And give them options. And have you spoken to any friends or family to keep track of their social engagement status? And if they have enough food or groceries for the next 48 hours or for next week. All of these questions can be customized. This is just an example for how you can do it. And during COVID, we were also helping them track the symptoms as well. So we know that somebody needs help. So once you get this report of data from the older adults, we transfer it to the community organizations so they can know the status of their population and know who needs help. If somebody is continuously answering, no, I don't have enough food, then you know that you need to check up on them and get them the necessary support. And the other aspect is, as I said, satisfaction surveys. How are you satisfied with this particular service on a scale of 1 to 10? They just have to type in the number, and that'll be easy. And also we do trivia games. As I said, we do trivia games, especially over the weekend where none of the programming is happening and some older adults may be more isolated during the weekends. And we ask them 3 questions. One is about general fun and trivia, what's going on at the Oscars and stuff like that, but also around your programming. What was happening at the center last week? Did you know when bingo is happening and who won bingo, something like that, to encourage them to be more curious and engaged with your programming. Then the third is around awareness on health and nutrition. So do you know which foods have a lot more vitamins and which ones you should be taking if you're lactose intolerant and things like that. So you can use these fun and engaging ways to improve their overall education and awareness, use them to improve their awareness about dementia, Alzheimer's, all the key risk factors that we have as we go through aging. And as I mentioned, you can track the data all in one place in a dashboard. You can also use the platform to send out broadcasts in a one-click way. And in terms of now pivoting to implementation, so as I said, you can use these tools. I showed you one example, but you can deploy any other tool that you need in terms of improving your efficiency and capacity. And this can be about automating some of your routine tasks using technology, but also you can use some complementing your existing resources with older adults as ambassadors and champions of your programming to spread the information via word of mouth. And you can also use volunteers to complement what you're doing. But as we learned, you cannot be dependent on them, but you can still complement what you're doing through volunteers. So those are different ways in which you can increase your capacity. But when you're implementing new things in what you're already doing, I think there are a few things to keep in mind. One, as we know, like you want to start in a small scale. You need to select an appropriate starting group of people you want to test it in. For example, if you're testing a new technology tool, you want to have some starting group of older adults who are comfortable with technology or savvy, and you start with them, and then you slowly expand that tool to other groups and more groups like them. And as you do that, you need to collect data. You need to learn from it. First, you design an experiment, and then see if that experiment worked, because you have a result that you expect. If that didn't happen, go back and understand why it didn't happen, and then have a method to even measure that. Like a simple, when I say experiment and measurements, it can be as simple as just having a paper-based survey. If you don't have any technology tools, just collect satisfaction or to get input from the people involved, including staff and older adults, to see how everybody experienced it, and then do any necessary improvements before you expand it. Because as we know, change and behavioral habits, when it starts small, it's easier to implement. And then this third aspect is also measuring what matters and being data-driven. So data is the key word that everybody hears today, everywhere. But the most important thing here is, what are you collecting it for and how are you using it? So in this case, you should collect data to know more about your older adults. Because when you collect data from somebody and you want to know more about them, it shows them you care. It shows them you want to know about the person much more than just being a client who needs help with something. And so when you know more about them, you improve the quality of your service. And the second aspect is also how you use the data. As I said, when you collect the data, you know that 50% of my older adults like broccoli. 50% don't like broccoli. Then you know in the meals you're serving, you want to have a mix of two options that includes broccoli and doesn't include broccoli. Just a simple example of how to do things with the data. And then the fourth aspect is around evidence and showing your impact to diverse funding sources. As more and more the keyword social determinants of health come in play, the key aspect is the future is moving towards bridging social with healthcare, right? That's what brought me into social services. I have a background in healthcare. I realized we're not doing enough to prevent things before it happens. And that preventative aspect happens in social and happens in community. So the more you collect data that your service is impacting your older adults' health and well-being, and you're able to show that, for example, people who have chronic conditions with diabetes, obesity, when they come into your programming, they're able to maintain their weight, or they're not having to increase their medications for diabetes. Simple things like that, even if it's self-reported, can show that you're making a difference on their lives. And that in turn can help you diversify your funding source, get more collaborations with health systems or others who can increase the resources available to you. So I want to show all those aspects in particular case studies with our community partners and how they have used different solutions to manage these challenges. So I want to start with Union Settlement. Union Settlement is a community organization in East Harlem. They've used our platform to send program reminders and surveys during the pandemic, and also acquired tablets to distribute to older adults to address the digital divide. So I'm going to start with them, and then we'll also talk about Catholic Charities, Brooklyn and Queens, who uses a data-driven approach to customize their services. And that's about technology and data. And then I also want to talk about non-technology-based solutions that has been used by Dorot. They use a large volunteer base to stay in touch with their older adults. And then Griot Circle, who services LGBT older adults, and they've recruited older adults as their ambassadors to find older adults who are in need but don't get in touch with community organizations. And so they can recruit them and give them the right information so they can get help. So we'll see how these different organizations went about these. So I want to start with Union Settlement. As I said, they are a community organization supporting older adults since 1895 in East Harlem. They serve older adults through multiple programs, senior centers, naturally occurring retirement community, and homebound older adults. And they deliver culturally sensitive services in their languages like English and Spanish, but also they had an emerging Chinese population, so they also added Chinese. During the pandemic itself, they had a lot of trouble, again, as I mentioned before, like most people here had a very extremely challenging situation of reaching older adults and again, checking up on them even on how they're doing was difficult for them. So we partnered together in November 2020, right at the time when they were shifting to virtual programming. They were not clear, how am I going to help older adults adapt to this virtual programming? So we engaged with them to, again, help their older adults get information about their programs. So to give you more context, so we sent them program reminders. So these program reminders, as I showed before, were sent a day in advance. It was sent with the information of what is the program name, when is it happening, and the Zoom link. So the older adults can directly click on the link and join the program. So that's how we made it very low friction. And we also personalized the reminders in a way that they only got reminders for programs that they're interested in. If I'm interested in art and wellness, not exercise classes, I only get those alerts. So when you personalize it in that way, it increases their likelihood for participating in the events. So these are the different things we did, and we started the service in November 2020. I want to share some data on how it improved their engagement. So we started with 30 older adults, and today we have about 200 older adults using the service in Union Settlement. They receive program reminders via text or phone call 1 day in advance. And as you can see on the data on the right, what you're seeing is on the x-axis, you're seeing the date, and then on y-axis, you're seeing the average events that are attended by older adult per month. It's attended by one older adult per month. And the two curves, there are two curves here. One is the yellow curve, which is non-users or people who are not receiving the reminders. And then the one in the green is the people who were receiving the reminders. As you can see that the people who were receiving the reminders and not receiving were all attending about 4 to 5 events per month in December. But then as they started getting the reminders, by month 2, they were now attending 2 times more events than the people who were not receiving the reminders. So 8 events per month for people who are not receiving the reminders and 16 events per month for those who are receiving the reminders. And this pattern continued over time. This was, again, an important measure for us because it showed us that the influence or the impact of reminders is great. And it's even greater when you deliver it in a systematic way and in a way that's personalized to them. And this change continued through all the ups and downs in the attendance, as you can see. As summer started and people started going out, there were lower event attendance because senior centers were still not open in New York City. And so people were going outside the senior centers, but still the number of people who are the event attendance between these two groups remained higher. So what this showed us clearly was reminders work. And I'm sure some of you may have experienced this if you constantly remind your seniors as well about your programs. But it also, what this shows is also that you can automate it and still have good effect on your program attendance. We also asked seniors what they thought about the service. We asked them 3 questions. How useful were the event alerts? How much do you like the classes? And would you recommend this to others on a scale of 1 to 10? And as you can see, 85% of them were very positive about the service and were continuously telling others that you should sign up for this if you haven't already. And the rest, the 15%, we still followed up with them to understand what's going on, why were they not happy, and try to find ways to improve our service. We also did interviews with older adults and asked them exactly what they were talking about in the survey. Why do they like it? Why do they not like it? And a lot of them said that the reason they like the service is because it helps them, again, get the information in a systematic way a day in advance so they can stay abreast of what's going on at the center. And they like the fact that they get the Zoom link right in the message. And they also love the fact that we mix these with trivia games and other fun elements apart from just information. So I want to play an audio clip from a senior here.
Like the reminders because they indicate when it's on.
Oops, sorry.
Like the reminders because they indicate when it's on, and everything is right there. So, but like they give you a game prior.
Sure.
Like if you're gonna have an event Thursday, they'll send it what to keep your breath. Like I say to myself, oh, I know this class is going to start, but then when I look at my text, and then I'm like, so it's really helpful. Or it's so good because I like when they text the information, the link is right there.
Yeah,
All I have to do is click on the link. That's so convenient. I love that.
I see. Okay.
And other than that, I think it's wonderful. I love the trivia game.
Yeah, so we really love talking to our older adults and learning more about beyond the service itself, what they're going through. But this was lovely to hear and really gives us the motivation to keep doing this. And I want to share some clip here from the Director of Senior Services at Union Settlement and how she reflects on this pandemic and how they underwent this.
Hello, everyone. My name is Lara, and I'm the Director of Senior Services here at Union Settlement, located in East Harlem. Of course, the pandemic has been a great challenge for everyone in the city, but specifically our older adults. So the biggest challenge that we faced at the beginning of the pandemic was how are we going to get services to our seniors? How are we going to make sure that our seniors are staying connected to us and to one another? And that's when we decided to partner with Union Health, which since the beginning or early on in the pandemic, they were able to help us, get out text message reminders for our seniors, not only about activities so that they can remain engaged, but also about this kind of services that we were providing. So when we did holiday meals during Christmas and Thanksgiving, we were able to let our seniors know, hey, yes, the senior centers are still closed, but you are more than welcome to stop by and grab a special meal for the holiday. Blooming Health has also not only been able to send out text message reminders, but has been able to help us send out weather emergency alerts. So during the winter time, whenever there's a snowstorm coming, during the summer, when there were the many heat waves that we had this year and last year. So they were able to help us in that sense. With Blooming House help, we were able to collect data and track, hey, is this really helpful? Is sending out a text message reminders helpful for our seniors? And we realized that yes, it was. Attendance was 3 times higher for those seniors that were connected with us through Blooming Health than for those that opted to not join the text message reminder service. And Blooming Health actually took a step further and decided to not only help us with reminders and alerts and tracking data, but also became a part of our virtual programming by having trivia games for the seniors where they will win gifts. So that was obviously very helpful for us, and it's also very helpful for the seniors who are just looking for different ways to, get engaged throughout the pandemic. I don't think this type of technology is going anywhere. I think this is just the beginning. And it was a great learning experience for us. And we're just now looking for ways to continue this collaboration and to continue to expand upon it. What else can we do to not only prepare ourselves for an emergency, but also to continue on with this dynamic of technology is not going on anywhere. Let's prepare our older adults for the future.
Sorry, is the audio okay, or should I increase it a little bit more?
That's fine.
Trying to, but I don't think it's being my friend. Is it okay? The audio, the volume? Okay. All right. So yeah, so that was Luz, and I'm glad she was able to share her experience. It's been wonderful and learning from them. And I also want to represent the experiences from other partners, as I mentioned, that will also represent other populations and demographics from New York City. So next, I want to show you also, yeah, another key piece about union settlement is that, as we mentioned earlier, a lot of people have had issues accessing internet, accessing tablets. So we partnered with another organization called Social Creatures, who were able to help union settlement get donations of devices that they got to seniors. And now seniors were able to use that and join the programming through that. So we were really glad that that could also happen in addition to our services ourselves. And then the second aspect I want to talk about is around data. Like, how can data help us know more about our population and customize your services? So one example I'm showing here is around the data around who is at a high risk for loneliness. Usually people, as this data shows from AARP, people who are less than 25K low income category are at 50% higher risk for loneliness. And also similarly, people who are divorced, separated, or never married are at a higher risk for loneliness relative to other groups. And also the people who identify themselves as LGBTQ are again at 50% risk for loneliness relative to others. So why is this information important? So knowing this information, again, will help you track the older adult social status, because the way these risk factors happen is it's not somebody at risk because they're always at low income or they're always at a certain situation. These situations change. And when they change, the risk factor is pretty high. When somebody loses a partner, they're at a pretty high risk for isolation at that point. And so you need to know when these events are happening in a continuous way. So again, you know when somebody is at a high risk and needs your support immediately. And so in terms of, again, knowing more about your population and delivering timely support, I want to share this example from Catholic Charities. Again, Catholic Charities of Brooklyn and Queens is an amazing partner of Blooming Health. They've been serving Brooklyn and Queens neighbors since 1899. And one particular senior center that we are going to show here from Catholic Charities is Bayside Senior Center. And they've been amazing in terms of how they've been data-driven and using data to know more about their population, but also to measure the impact they're having on their population and informing them through their newsletters. So through their newsletters, they not only let the people know that this is the data about the senior center, then when you ask a survey to older adults later on, it makes them more likely to participate in the survey because they're seeing these in the newsletters. And so in terms of Bayside's client base, their client base, like many of you here probably, it increased during the pandemic. They were serving originally about 250 older adults, and since the pandemic, they're now serving about 600 older adults. So how do you suddenly manage this increase in demand for services? They were doing, again, phone calls like most of you, but also this kind of phone calls were not becoming feasible anymore with the staff that they were having. So they partnered with Blooming Health to, again, systematically collect data from their members because they want to continue to be able to provide quality service, even if the number of people they're serving now increases. As the volume increases, they don't want their quality to go down. So that's how they're partnering with Blooming Health to collect data from their population and to use that data in a way that they can improve their services. So I want to share this video from Pang Chu, who is the program manager at Bayside Senior Center.
Hi, my name is Patty Chu. I'm the program manager for Catholic Charities Bayside
Do it right
Service Center.
there.
There were many challenges during the COVID-19 pandemic, and one of the main challenges was providing consistent support and services to our seniors, ranging from wellness calls, shift to virtual programming, and technology support. The solution to this challenge is really to provide consistent service with control
That
organization.
works.
For example, doing wellness calls only at a specific time, providing virtual programming type to specific days. For example, singing will be Tuesdays and exercise classes will be Wednesdays. Teleconference calls on Thursdays. It was just an easier way for seniors to remember and process, avoiding stress for everyone. We use technology apps, Zoom, and just basic phone calls to provide our services and collect data information. The data we collected ranges from what they didn't like about their food, drilling down to specifics like how they eat broccoli stem, or how Asian seniors prefer Italian type food because they prefer something different. I think honestly, data-driven approach, when it's applied correctly in an older adult service setting, show that you care. You care about their opinions. I think and hope that Blooming Health will assist in this approach, assisting senior services by providing a more consistent support services to our seniors, how they can reach out consistently to our members, and assisting my staff to support close to 600 senior adults. The key to data-driven approach is really the follow-up and communication process afterwards. I would like to add that this process
All right, here's this.
because again, it's about collecting information consistently. I would not think of this as using technology to get answers, but the approach is more about communication and using technology as support. Thanks so much. Please take care and be safe.
All right. Yeah, I think he said it well. I think that really what he said that spoke to me was the fact that you collect data because people, you want to know that you care about them, and that'll make them, again, more likely to give you that information. So the other example that I want to share next is about Darat. So Darat is an organization that is focused on addressing social isolation and loneliness in New York. They're based in Upper Manhattan and also serve older adults in the Westchester area. And Darat has been serving about 4,000 older adults, both homebound and those who are coming into their centers. But their main approach is to use volunteers. So they have a system through which they recruit and manage a large base of volunteers through their synagogues or through their religious organizations, but also through family and friends. And they've maintained this volunteer base, and they've been able to leverage them through COVID to, again, as they pivoted to computer and phone-based programming, they were able to provide technology support, for example, in a large scale. They were able to man a telephone line that would give technology support. So I want to, again, share this as another option that many of you can consider as you think about opportunities for improving.
All right, see you in a little bit.
This is Mark Meridy, who's
boy,
the executive
Gabriel.
director for Darat.
All this stuff has to be picked up, especially those screws, because they're not easy to see.
Hello. I want to thank Blooming Health for the invitation to speak with you today. My name is Mark Meridy, and I'm the executive director at Darat, a nonprofit organization whose mission is to address the issue of social isolation and loneliness. We accomplish our work by engaging thousands of volunteers and by offering a wide variety of programming for older adults. Prior to COVID, Darat's approach for alleviating social isolation was focused primarily on in-person programming. The one notable exception to this was our long-standing teleconference program, University Without Walls, which was launched more than 30 years ago to create a community over the telephone for older adults who were largely homebound. Now, we know that social isolation and loneliness can have devastating healthcare consequences, and this became particularly acute during the pandemic. Effective and meaningful communication and social engagement has played a critical role during this very difficult time. COVID required that we think all aspects of our programming here at Darat. One of the things that we know is that there is a huge digital divide, which is why we have continued to rely on both the computer-based programming as well as the old-fashioned telephone. With the extraordinary work of the Darat staff in March of 2020, we established or maximized the following remote communications solutions. We converted all of our in-person programming to on-site at home, using the Zoom format. This enabled us to engage over 2,500 older adults from 37 states who participated in over 875 programs, as opposed to the 20 to 60 people we could accommodate here in our auditorium at one time. We also established Caring Calls, which is essentially a phone-based friendly visiting program that enlisted the help of hundreds of volunteers to be matched with an older adult. We had staff and volunteers make thousands of telephone calls to all of the older adults in our database to check in on them. And I'm particularly proud of the fact that we more than tripled the size of our University Without Walls program, which is the teleconference-based program where sessions are offered on a wide variety of topics. Classes are intentionally left small in order to foster meaningful social interaction. While technology certainly cannot replace in-person connections, we have found that by both using the telephone and video-based platforms, we have been able to help foster important social connections, which was really important during the pandemic. For older adults who had the technology but did not know how to use it, we created a tech coaching program where specially trained DeRoad volunteers provided home-based and phone-based help for accessing Zoom, FaceTime, or setting up an email account. DeRoad volunteers play a critical role in our success. Please reach out to us if you would like to learn about our recruitment, training, and retention strategies. As community-based organizations, area agencies on aging, and other entities serving older adults, we would be delighted to work with you to bring our programs to your community, all free of charge. Thank you for your time, and I hope you have a wonderful day.
I know we're running out of time, so I'm going to quickly talk about our last example here, which is from Greer Circle, which is a community organization that specifically serves LGBTQ older adults, including older adults of color. And they're based again in New York City, in Brooklyn. They use a very grassroots approach of connecting with older adults. And that's why they have this tree approach, as they call it, where they use older adults to engage LGBTQ older adults of color who need help, especially people who are not aware of Greer Circle or not seeking help but need help. They know, the older adults know where to find them, and therefore they can help them know more about the services and engage with them. And so I want to show you the last video from Andre, who's going to share some thoughts on how they serve the LGBTQ community and how they resolve some of these challenges.
Hi, my name is Andre Guest. I'm the Deputy Director here at Greer Circle. Greer Circle is an older adult organization with LGBTQ.
Sorry, I think it's pretty low, the volume. I don't know if I can increase this. It's at 100%, sorry.
Hi, my name is Andre Guest. I'm the Deputy Director here at Greer Circle. Greer Circle is an older adult organization that works with LGBTQ adults over 50. The most critical aspect for us was not assuming that what was best for us was best for members. So we have to recognize that sometimes for elderly adults, especially for LGBT older adults, they may not necessarily live in a house where either Wi-Fi is provided, where they are the primary head of household, or they have options of having Wi-Fi at home. But in the beginning, we also had a wellness group where we had an open chat line every day from 12 to 1. We felt it was important that it was consistent so that those who were able to call in could call in. So we used something similar to a free conference call where anybody who had that number could call in Monday through Thursday from 12 to 1, and be in community with people who are pretty much in the same situations. Because
I'm sorry. I don't think we can hear any of that.
Our adults, it's a
Okay,
population.
I'm gonna skip that one. Sorry about the audio issue there. I will try to upload these to YouTube and share links later on. Apologies. All right, so basically the key message that Andre was delivering there was about, as I mentioned, they really thought about the LGBTQ older adults, specifically about what challenges they are going through. A lot of them won't even opt to be homeless. They would be couch surfing and will be living in somebody's home where they're not allowed to use their internet. So they will not have access to internet and cannot use internet. And therefore, they decided to use phone calls as their primary method of communicating with the older adults. And they also decided to, again, as I said, plant ambassadors of older adults who know where they can find the LGBTQ older adults and direct them to the resources. So this is the last poll for today. So if you are able to join this poll, I just want to hear from everybody on how you are thinking about the future, especially compared to the pre-COVID era. What is the optimism that you carry? What do you think is going to be changing in terms of home and community-based aging services in the future?
I just want to remind everyone, we're coming to a close. If you could please, before you leave, fill out your evaluations, and I'll be at the back of the room to collect them.
Don't think this is displaying the answers. All right, so the last thing I'm not able to share the results from that one yet. So I'll try to again put it in the slides, update it later. So the final summary that I want to leave you all with is what we talked about today. So as populations are aging, there's increase in need for home and community-based services. Especially, there's a critical opportunity here to influence them towards more healthy aging lifestyle through community-based programs. So how can you efficiently connect with older adults as you increase your services, as there's more demand for your services? You can lighten your load. You can use automation technology as necessary to replace some of your routine tasks. You can amplify your outreach via older adult ambassadors and volunteers. You can use a data-driven approach to know where to direct your resources, how to improve your services, and also be inclusive as you cater to a diverse community of older adults. And definitely, as you incorporate these new tools, try to use the tested small and in small groups before you expand them. And again, use information to improve that iterative process of learning and expanding. And as you, again, prepare for this more higher capacity, you can seek more diverse funding, especially healthcare is something to tap into beyond the traditional aging services funding sources. And in order to tap into healthcare-based funding sources, data and showing the impact of your services on health outcomes will be very, very critical. And there's a lot of opportunities around this in the community. And given our background, we will be happy to help you as well if you're interested in looking into it. I want to leave you with some questions to consider as you think about what went on in the past year. Definitely, there were a lot of learnings. Specifically, what did you see as working with your older adults in terms of engaging them, and what did not work? What were others in the community opting for? Which ones could work for your community? And also, as you go towards a more hybrid world where you're going to have both virtual and in person, how do you adapt these different tools in that setting? Can you support the growth and impact with more funding, more resources, or being more efficient in how you deliver your resources? All of these are critical questions and definitely a lot more to think about. That's what I have today. Happy to answer any questions. Yeah. Hi.
Hi. Slide where you were showing between people's preferences of communication. There's something like top 25%. I had a question about the text portion of that. based on that graph, it looks like 65% of older adults are saying that they prefer communicating via text. This one, thank you.
Yeah. So they use cell phone for various purposes. So that is around the purpose of cell phone use. 65% of them use cell phone for texting.
And then on the right graph,
That's the preference that you were talking about. And that's still like amongst 100%. Like the one on the middle will not add up to 100% because they'll have multiple purposes. But the one on the right adds up to 100%. And amongst that, at least 30% of them or so said they would prefer talk or phone calls. New York City, yeah. But texting is still a minor portion of it. Texting is still only 10%.
but of the people that did ask for text messages, they were 3 times as engaged in events as a non-asking.
Yeah, no, that was interesting because in terms of text message, it's non-intrusive. It's asynchronous, meaning you don't have to pick up the phone call when somebody is calling you. In the case of text message, you can look at the text message anytime you want. So it's possible that people don't prefer text message for two-way communication. Like this is a way for you to inform them and still have an impact because you're sending them information. And the two-way check-ins and surveys happen once in a while, like once in 3 months or once in 5 months and things like that.
Thank you.
Okay. Thank you so much for joining and have a wonderful day. Thank you. Yeah, I don't know what's going on with the WebEx piece. I don't know if people had questions there. I couldn't see them. Like you can only see people joining. I don't know if there was a video or not.
For them?
Yeah, but that's fine.
How did you get in? Like you had to go into the viewer?
So when, let me see if I can. I don't know what I need to do. They might hear me talking, but I think so. When
You
did
can just exit out.
mute? Can I mute? I don't know. Yeah, I don't know. It didn't exit. Yeah, no, we had to text them and they came.
So then what, so you put your slide in there.
Yeah, so you can use your USB drive and load the presentation and then,
On the desktop.
yeah.
But then did you have to log into the,
Yeah, the WebEx thing, I think he
did it?
Yeah, but I'm just trying to remember what he did. I don't know. So when the time comes for your presentation, I think they should have activated it 5 minutes before, but it did not. It
So you
activated
go
right
in
at the,
here,
oh no.
okay.
So, and then, so if your presentation is at 11 a.m., it becomes green at 11 a.m. So you click on that. So you join the session, but you have to share the screen. Yeah, you have to share the screen for it to go through WebEx. Similar to the Zoom. So you share the screen and you share the specific screen, like maybe this one, not that.
So you have to put on.
So I'm not able to stop the screen sharing either. Why? Show myself. No. I don't know what's going on.
I'm gonna have to call somebody.
Yeah. I think it's better to text somebody maybe 5 minutes in advance.
All done?
Yeah.
Yes.
Okay.
Sorry.
Will somebody be, so I'm presenting at 3:30.
Okay.
Will somebody be here to help out?
I'll be up here running back between the rooms, just making sure everybody's all set up. But let's go over it right now while you're here and just make sure that does that sound good?
Somebody's presenting or you?
It's supposed